Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about surrogacy. So go ahead, subscribe, and let's get started. Surrogacy is when a woman agrees to carry a pregnancy and give birth to a baby for another person or couple who cannot have a baby on their own. The woman who carries the baby is called a surrogate mother, and the people who will raise the child are called the intended parents. This arrangement is usually chosen when there are medical problems, infertility, or other situations where pregnancy is not possible or safe for the intended mother. Next, we will see the types of surrogacy. Gestational surrogacy is the most commonly used type of surrogacy. In this method, the baby is created in a lab using IVF, where the egg and sperm are combined outside the body to form an embryo. This embryo is then placed into the surrogate mother's uterus. The important thing to understand is that the surrogate mother has no genetic connection to the baby. The egg and sperm usually come from the intended parents, or sometimes from donors if needed. Traditional surrogacy is a type where the surrogate mother's own egg is used, so she is biologically related to the baby. In this case, fertilization usually happens through artificial insemination, where sperm is introduced into her body to achieve pregnancy. So, unlike gestational surrogacy, here the surrogate is both the one who carries the baby and also has a genetic connection to the child. Surrogacy can also be classified based on whether the surrogate is paid or not. In altruistic surrogacy, the surrogate mother is not paid for carrying the baby. Only her medical and pregnancy-related expenses are covered. This is usually done out of goodwill, often for a relative or someone close. In commercial surrogacy, the surrogate mother is paid for her role in addition to medical expenses. However, this type is illegal in some countries, including India, where only altruistic surrogacy is allowed. Surrogacy is usually chosen when a person or couple is unable to carry a pregnancy on their own. This can happen if the woman does not have a uterus or has had it removed, making pregnancy impossible. It is also considered when there have been repeated IVF failures, where embryos are formed but pregnancy does not occur. In some cases, a woman may have medical conditions like severe heart disease or other health problems, where pregnancy could be risky or life-threatening. Surrogacy is also an option for male same-sex couples who want to have a child, as well as for single individuals who wish to become parents. Surrogacy also comes with some risks and challenges that need to be understood. The surrogate mother may develop emotional attachment to the baby, which can lead to psychological stress for both her and the intended parents. There can also be legal issues, especially related to parental rights, which may vary depending on the country and laws. Like any pregnancy, there are medical risks involved, such as complications during pregnancy or delivery. In addition, there are ethical concerns, as people may have different opinions about the practice of surrogacy and its impact on society. Surrogacy in India is strictly regulated by the Surrogacy Regulation Act, 2021. According to this law, only altruistic surrogacy is allowed, which means the surrogate mother is not paid except for her medical and pregnancy-related expenses. Commercial surrogacy, where the surrogate is paid, is completely banned. The law also sets strict eligibility criteria for both the couple who want the baby and the surrogate mother, to make sure the process is safe, ethical, and not misused. The nurse plays an important role in supporting both the surrogate mother and the intended parents throughout the surrogacy process. This includes giving proper counseling and emotional support, as the situation can be stressful for everyone involved. Nurses also help by educating both the surrogate and the parents about the procedure, pregnancy care, and what to expect. They closely monitor the health of the surrogate during pregnancy to ensure both mother and baby are safe. At the same time, nurses make sure that all care is provided according to ethical guidelines and legal rules. That brings us to the end of this video. I hope you found this video informative and helpful. Thank you so much for watching. And don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.